The southern state of Kerala has now become a COVID epicenter, struggling to cope with a massive spike in daily COVID cases. Amid the surge, Kerala will now be witnessing a lockdown on 31st of July and the 1st of August, like every weekend. Kerala, remember, now continues to account for more than 50% of all cases now being reported in the country. It is a massive cause of concern. But with the state reporting over 22,000 cases for the second day in a row after 5-day high registered a day earlier. Now, Kerala has reported over 10,000 daily cases all through the month with a 7-day average of nearly 17,000 cases. Kerala positivity rate is now over 11%. The centre has rushed a 6-member team headed by Director National Centre for Disease Control, urging for adherence to all COVID protocol and avoid mass gatherings in Kerala. The state government, meanwhile, has been pulled up by the opposition BJP, which is quick to target the Vijayan government over the 3-day relaxations that were given for the Bakrid festival, which is, they are linking it as BJP as opposition to the spike in cases in Kerala. The state, once touted for controlling COVID effectively, keeping deaths at a low and sending healthy people back home, is now in the news for all the wrong reasons. Kerala now accounts for 50% of COVID-19 cases in India.
अगर आप देखें कि देश में आज भी चाहे केसेस कंसंट्रेटेड मैनर में पाए जा रहे हैं, लेकिन अभी भी देश में 22 ऐसे जिले हैं जहां पर कि पिछले 4 हफ्तों में हमने एक इंक्रीजिंग ट्रेंड इन केसेस नोट किया है. हमने आपको दर्शाया है स्टेट वाइज ऐसे कौन से जिले हैं जहां पर कि वीक ऑन वीक बेसिस पर अगर हम देखें तो पिछले 4 हफ्तों में केसेस में संख्या में वृद्धि हुई है. यह वृद्धि एक मान लीजिए कि लिमिटेड नंबर ऑफ केसेस से थोड़ी भी वृद्धि है तो यह कॉज ऑफ कंसर्न है जिसके लिए हम स्टेट से डिस्कस करते रहते हैं.
A drastic increase of cases has been seen in the last 4 weeks. Documents accessed by India Today show Kottayam has seen almost 64% increase in cases in a month. Malappuram has seen a 59% jump in cases. Thrissur recorded a 45.4% rise during the same period, and Ernakulam has seen a 46.5% increase.
India Today has accessed this letter that has been written by Union Health Secretary Rajesh Bhushan to the Kerala government, talking about the fact that the central team that visited Kerala in the first week of July has made some observations about what really is going wrong in the state. Containment has to be improved in the state of Kerala. This letter also talks about the fact that certain super spreader events have been witnessed in the state of Kerala, which has clearly led to the spike.
In his letter, the Union Health Secretary says Kerala needs to do more in terms of containment. Home isolation cases, currently accounting for 95% of the active cases in the state, need to be done as per the guidelines of the Union Health Ministry. Bhushan also points out that between July 10 and 19, Kerala has seen a spike of 91,617 cases and 775 deaths. The centre says ramping up vaccination and reducing wastage is needed. Higher test positivity of 10.5% may require more stringent measures and restrictions. The centre says another problem in Kerala is non-adherence to COVID-appropriate behaviour among migrant workers. It says some positive patients have refused to get admitted to isolation centres and they need counselling. The centre has already sent a team to Kerala to review the situation in the first week of July. A team is being sent again. With Sneha Modani, Bureau Report, India Today. My colleague Gopi Krishnan Unithan is now joining me live for further latest on that. Gopi, so we've been tracking the political face-off now since the past 2-3 days. But what is the status on the ground with regard to the state government? Are they planning to impose a lockdown? Are they planning to avoid any super spreader events?
Well, Pooja, to be honest, the government hasn't really planned for any particular specific restrictions or any new restrictions in the state. The only restriction that is coming is the extension of the weekend lockdown. Remember, the weekend lockdown has been in place in Kerala right from the beginning of the second wave. So that was actually the first phase before going into a complete lockdown sometime during May month this year. Now, this particular weekend lockdown is continuing, is what the government is saying. And apart from that, there are no further extra restrictions which are put in place in Kerala. Even when we look at the data from Kerala, yesterday Kerala reported more than 22,000 cases, but the test positivity rate has come down a little from 12.35 to somewhere around 11% is what yesterday's TPR is suggesting. So these are multiple factors which the government is trying to weigh and balance between life and livelihood, trying and ensure that the restrictions does not really curtail the lives and livelihoods of people.
Gopi, please keep tracking all the latest. Gopi Krishnan, remember, has been tracking the ground updates. There will be a weekend lockdown. Is it enough? Could the government go ahead with further restrictions? We'll wait and watch for the government reaction coming. Thank you so much, Gopi Krishnan. So why is it that the Kerala government is really now being attacked by the opposition parties? Why is there a surge and why is it worrying? Number one, high cases may lead to the third wave. Number two, indications are of a possible presence of a new variant, and that perhaps is the biggest worry. Number three, there is a confirmation with regard to low immunity rate that is coming in with regard to communities there. Number four, the state has been lax in restrictions at a time when many other states in northern India are cancelling or postponing religious gatherings or events. We have super spreader events, so to say, that are now being organized. There were relaxations for Bakrid festival. There's the Sabrimala shrine visits of devotees that continues, and that clearly establishes the flouting of COVID safety norms and therefore confirming the less impact of triple lockdown. So the weekend lockdown is in place. Is it enough or is it not? Then we'll wait and watch for the government reaction. And now US is once again leading in the daily number of COVID